Good morning, everyone. Welcome to this live stream session of the Oversight and Engagement Board for the 10th of December. I'm going to go straight to the minutes from the previous meeting, which was held on the 26th of November. I presume everyone is happy with those, unless they put their hands up and say otherwise, so we'll sign those off. Thank you very much, everybody. And we come swiftly to Lucy Whiteman for the summary of the local surveillance data. Lucy, good morning.
Good morning. Thank you, Councillor Morris. So this is last week's weekly surveillance report. So it contains data up to the 29th of November. So obviously the new one gets published tomorrow. And in the week up to the 29th of November, obviously our key messages were that we thankfully had just managed to get below 1,000 cases in the week up to the 29th of November. And that was a reduction on the previous week. So was good news, and we're starting to look something like the pre-lockdown levels. So good progress, and clearly starting to see the benefit of that restricted movement between households, because the majority of transmission when we do our contact tracing does still appear to be between household members and then between households where households are mixing. So clearly that lockdown with that restriction having an impact there. So we've obviously come out of lockdown in that week as well, and obviously we went into tier 2, so up from tier 1 previously, and slightly different tier restrictions as well, so making sure that everybody familiarises themselves with the new requirements in Northamptonshire. And one of the concerns that still remains, however, despite those more positive messages, is that the case rates in the over 60s are still challenging us. So these are our more vulnerable population who are likely to end up having more severe symptoms, and sadly also more likely to die from COVID-19. And that is translating into increased numbers of admissions from COVID in both of our acute hospitals. But if we go to the first page of main data, so as always, we include information about what we're able to do and what we're doing locally. So if we just, that's it. So obviously here you can see those 946 cases in context. Again, just reminding people that pre-lockdown, we had that 54.3% increase in cases because people went out and sadly, I think, did do things that perhaps in hindsight may not have been sensible, and you can obviously see the repercussions of that with that significant jump as we went into lockdown. As I've just said, we're now sort of back at pre-lockdown levels, so we haven't quite gained as much as I would have hoped from having that lockdown period. Our case rates are still obviously much higher than they were in late summer, but at least we are back down to a sort of more manageable level of cases. If we go on to the next slide. So here you can see obviously that's been an effect in all areas other than East Northamptonshire, where the case numbers have stayed broadly the same. Again, it's still worth looking at the fact that these are still quite large numbers in some areas, and therefore there's obviously still more work to do, and people need to remain very, very cognizant of the impact of their actions as we're now in tier 2 and able to do more things than during that lockdown period. The next slide demonstrates that you can see that we've obviously started to get that downward trend from the lockdown effect, but nationally, and you can see it actually more so in the Northampton data here, it's already starting to plateau. And obviously the risk is over the next couple of weeks as we go and do our Christmas shopping and prepare for Christmas, that indeed we'll see our case rates start to creep back up again. So we must obviously try and do our best to maintain our position and that sort of positive case rate position as we come out of lockdown. On the next slide, please. It obviously shows that breakdown again between males and females, and you can see that impact there in the older age groups. That's sort of quite big increase in both males and females in the 60 to 69 age group, and also in the 80 plus. Clearly there are some links there with outbreaks in care homes, but it doesn't explain the increase in our over 60s case rate across all of our boroughs and districts. So we're still advising obviously everybody who's aged over 60 to be reducing their contact with any other family members or the wider community wherever possible, because they are at increased risk, sadly. If we go down to the next slide, this is obviously that over 60 case rate trend, and you can see sort of big variation in boroughs and districts. Thankfully, Corby, which was sort of really outstanding from a point of view of the otherwise rates elsewhere has now started to come back down, but you can still see there's quite significant fluctuation week on week in this case rate. Thankfully, as I said, both Corby and also South Northants have started to come back down to the county average, but obviously we need to continue to improve on that position. As we've got a number of poorly people still in hospital. It was 255 people who were COVID positive in both of our hospitals yesterday. So, you know, this really is translating into very sick people who are needing significant support from our acute trusts. If we go on to the next slide. So we've got the case rates by borough and district here. Obviously, we've still got Northampton, sadly, sat slightly higher than the county average. And similar to the England average, we've obviously managed to maintain a position of having a lower than England average rate in our boroughs and districts. But, you know, we've talked about not being the best of a bad lot before, and that still very much is my mantra here. There's still, you know, significant improvement that I would ask that we aim for in our case rates across all of our boroughs and districts. As I said, you know, Christmas relaxation is going to push our numbers up, so we need to make sure that we're in the best possible position before people start mixing, if we're going to be able to manage the fallout of that, both from a point of view of community economically and also in our acute hospitals again come January. On the next slide, please. So this provides you with that snapshot of the current position of our education settings. The University of Northampton continue to maintain a really, really positive position, and in the data up to the 29th of November, they'd had only 10 reported cases. And obviously they're already undertaking the lateral flow device testing to identify people who may have, you know, high rates of COVID, so that they can self-isolate before returning home. Across the rest of our sort of normal schools, we've got all of our data there, 100% schools open again, which is really, really good news, and a slight improvement on the number of pupils attending as well in the last week. The next slide. So if we go down to the outbreak position, if that's okay, so people obviously can have a look at the different areas and the case rate of change. Here, obviously, in the period up to the 30th of November, you can still see that we've got a number of community outbreaks that we're managing. So these remain open for 28 days after the last positive case was identified. So I don't want you to obviously think that these are new. These are ongoing outbreaks. Again, you can still see that they are distributed across all of our boroughs and districts, with a focus in Northampton being our busier and more densely populated area, but again, still featuring across education very heavily, most of the transmission of which is still happening outside of school, not within the setting itself. And again, we've also got a number of outbreaks at the moment in care homes, fewer in workplaces. And again, we think that's the impact of lockdown. But obviously schools have continued to operate as have care homes throughout lockdown. So we would expect to see less of an impact there. One of the challenges obviously continues to be our outbreaks within our hospital settings, and that obviously also does then play into the additional pressure on the beds that we do have available. So we're working very hard with both of our trusts to make sure that they're fully supported to obviously maintain as many open beds as possible. The rest of the pack, obviously we've got a slight update on flu, I think is next. So we've got a good position for most of our cohorts. So again, apologies, we still don't have national data about the extended groups for flu vaccination this year, but of the standard groups that are offered vaccination every year, the 65s and over, we've got nearly an 11% improvement on last year's uptake, which is really, really good news, particularly with, you know, people being more vulnerable the older they get. We want them protected from flu before they start having their COVID vaccination. And again, a good news story around the younger age groups that have a long-term condition, with a nearly, you know, just over 9% increase in uptake. Again, children, really good uptake this year, 32% increase on last year's figures at this point in time, but disappointingly we're still not seeing as many pregnant women come forward for flu vaccination as we would like. Now, these ladies are not going to be eligible for the COVID vaccination, so we want to make sure that they're protected from obviously flu, which can also be a significant and serious respiratory infection as well, can also pose a risk to their child when born because of such low immunity in newborn babies. So please do encourage anybody you know who might be pregnant and might be worried about having the flu vaccination to come forward and obviously seek support and or advice if they do want some. So the rest of the pack just includes the normal information about the activities that we're undertaking, and obviously who we work with in order to continue to get the best possible outcomes for local residents. So I'll stop there, Councillor Morris.
Thank you very much, Lucy, as always, for that whistle-stop tour through the figures. Been interesting developments and lots of things to keep an eye on, and obviously to keep obeying the regulations and the rules as we lead into Christmas. Toby Sanders got his hands raised. Toby.
Yeah, thank you, Chair. I just wanted to expand briefly on a point that Lucy touched on partway through that presentation. Lucy, you mentioned the number of 255 in terms of the number of inpatient COVID positive patients in our 2 acute hospitals. And I just wanted to put that into context because I think it's helpful for people on this call and viewers as well. The NHS across the county at the moment in Northamptonshire is running incredibly hot. The number of 255 is larger than at any point through the pandemic to date. So we've got this really quite mixed, strange period, I think, for all of us to get our heads around, Chair, at the moment, which is some broadly positive direction that Lucy's just described on community transmissions, which is clearly welcome. We've had brilliant news this week around the vaccination programme, and here in Northamptonshire was delighted that at 9:38 on Tuesday morning we had the first person vaccinated in the county at our first hub at Northampton General. And there's a huge effort underway across health and other partners locally to put in place our arrangements for the rollout of that vaccine programme over the coming weeks. So we've got primary care sites that have been identified that we're hopeful of being able to roll out into next week across 7 different areas within the county, and also then other hospital sites as well. So that's kind of our way through that, and we all know this, but the reality here today of where we are across the county is that our NHS, and that's not just the acute hospitals, our community hospitals, our mental health services, are busier and under more pressure and running hotter than at any point through the pandemic to date. And we're not actually anticipating that over the coming days that's going to ease significantly. We've just had the toughest weekend that we've had this year so far, and we're bracing ourselves for that to continue running. So I guess the reason, Chair, for just bringing that perspective in is we've got really positive news on some of the community position. Similarly, in terms of the vaccination programme, which is just tremendous news and gives us all a ray of hope that we're going to see a way through this. But actually the importance of what I know we're all very fatigued of working through in terms of those basic messaging is so important because of the kind of pressures that we can still see in our county in particular at the moment. And sadly, that has meant we've had to cancel elective work over recent couple of weeks. We've also started to see increases as well in some of the ambulance handover delays at some of our acute sites. And that's just a reflection of the intense pressure we're working under. So as ever, our NHS staff are doing an amazing job looking after and supporting people across Northamptonshire. But I really would, on behalf of all of my colleagues in the NHS, urge the public and the local people to continue doing what they have so well at points through the last 8 months, and sticking as much as we can to the kind of guidance that is there to help us to bridge across to the point when that vaccination programme really rolls out more broadly. Thank you, Chair.
Toby, and I think we all agree with that. I mean, the message about protecting our NHS is often lost at this later stage of what is happening, and it is still very sobering to hear the realities of what the health service are dealing with currently in the county and across the country. And we can never forget that, and that's one of the primary reasons for doing what we're doing with the tiers and everything else. So again, I would thank you for your hard work, and let's all stick together on the tier rules and the general rules going forward, so that we can protect our NHS and try and drive down the COVID-19 situation, and obviously to try and prevent as many deaths as possible from COVID, which we have sadly seen in the county as well as a result of what's happening currently. So thank you very much for that, Toby. I'm going to come now to just looking around the room, see if there's any questions. I don't see any. So I'll come back to Lucy, please, for a testing update. And again, this is another crucial area in our arsenal against COVID-19 that we must maintain going forward until such time as the vaccine has been rolled out to everyone. Lucy.
Thank you, Councillor Morris. So good news in as much as our testing rates continue to remain reasonably high across all of our local testing sites, and they will all remain operational. So that's the local testing centre in Wellingborough, Northampton, Kettering and Corby, and then also the regional testing centre, they'll all remain operational, I should say, over the Christmas and New Year period. They will have a few days where they are running on reduced hours, so 9 till 3 rather than 8 till 8. And all that information obviously will be updated on our NCC website, but also will be reflected in the appointments that you're able to book at those sites as you go through that national portal system. So, don't think that you need to be able to remember the dates. It's just to obviously forewarn people that there will be some days where there's a little bit more limited availability, but availability there will be. Obviously, home test kits continue to be available and are being turned around really quickly. You usually receive one within 24 hours of requesting it, and then again you usually get your result back within about 24 hours, so sometimes that's even quicker than waiting for the local testing service. Obviously you just need to make sure that you post it quickly at one of the designated post boxes, but they are numerous and obviously cover our whole county, so that's a very, very good service as well. The 2 mobile testing units will be stood down over the Christmas period. And obviously we'll keep partners informed as to where those new locations come the new year will be for those mobile testing sites. But obviously that will be dictated by the patterns of the virus prevalence at that point in time. So I wouldn't like to hazard a guess where they'll be at this point, but we'll monitor data as we always do and move those according to where they're needed most. So just to give people a bit of an update on the normal PCR testing, from a point of view of lateral flow device testing, so these are the rapid tests, we're obviously looking at how we can support public sector workers to utilise those so that they're able to identify any risk in staff and to manage any potential outbreaks. And we're hoping to have our delivery of lateral flow device tests before Christmas so we can start to roll that out. But already obviously arrived at some of our local care homes, and obviously care homes working really hard to make sure that they can facilitate visiting wherever possible, but we do just ask that the public are patient. Not all care homes will be able to facilitate visiting using lateral flow tests because it is still quite challenging logistically to find a space for those tests to be undertaken. So do bear with each of the settings and obviously be led by the management within each of the care homes. Just so people are aware as well, obviously we're still using lateral flow device tests for NHS staff and also for care home staff and residents alongside PCR. So we've got many more tools in our toolkit at the moment. But obviously PCR testing still remains the gold standard, and therefore if anybody has any concerns, developed any symptoms or been identified as a contact, they should be going and booking a PCR test through the national portal as soon as possible, and obviously isolating until they get their negative result. If it's positive, they must obviously continue to adhere not only to the rules but now to the law, that is that you must remain at your home for 14 days from the test result, from the test date I should say. So happy to take any questions on testing.
Thank you, Lucy. I've got a couple of hands up. I just wanted to step back a little bit to the flu vaccination as well. I should have asked you then. Very good news on the uptake, but it is worth probably reiterating the need for more people to take it, and also timings around the vaccination, because that you can't have, as I understand it, you can't have the flu vaccination. It has to be a certain time before you can have the main vaccination for COVID. So it might be worth you just reiterating that message before I come to Phil and Chris. Thank you, Lou.
Yeah, absolutely. So obviously one of the normal winter pressures is flu, and obviously we have a seasonal flu campaign every year, and this year it's been extended, as we've talked about, to younger age groups. And most people will have received by now an invitation from their GP practice to attend either a clinic or a particular appointment, or to contact the GP practice to book an appointment for their flu vaccine if they're eligible. Now, flu vaccine campaigns run all the way through to March, so some people will be surprised to receive perhaps an invitation for an appointment later in the year, but it's vitally important. Flu sort of does affect all of the winter months, that people still maintain that appointment even if it seems like it's further in the future than they would choose for it to be. If you have any concerns or you think you're eligible and haven't received an invitation, obviously contact your GP practice, or also attend your GP at your local pharmacy. Many of the pharmacies locally are able to give flu vaccines, and also your medical records can be updated accordingly. what you mentioned there also really important. If you are invited for a flu vaccination, soon, the sooner you can have it, obviously the easier it is to be able to arrange your COVID vaccination if you're eligible for that around it. You're quite right, you have to have a 7-day window as a minimum between your flu vaccine and the first COVID vaccination. And between the two COVID vaccinations, which are 21 days apart, you cannot receive your flu vaccination. So, there is a timing element here. So the sooner you're able to get your flu vaccination, if you've got an invitation already out of the way, the better. So please do take that up. If you've got any questions or concerns, contact your GP or ask your pharmacy for advice.
Thank you, Lucy. Sorry, I did step back a bit into your data there, but I've got two questions on, presumably on testing. So I've got Phil Begnall and then Chris Loss. Phil.
Yes, thank you, Chair. It was about the mobile test units. It was intimated earlier that they were being stood down. Is that just over the Christmas period, or was that stood down?
No, so that's just for the Christmas period. So they're likely to be running until around the 23rd. We've yet to confirm the exact date. And then, as I said, what we'll do is we'll take a view as to where they need to sort of reappear in the New Year period, dependent on the incident. So we'll put them obviously wherever we've either got less access to, one of the static testing centres, or where we've got high incidence.
Thank you, Lucy.
Thank you for that question. Very good question. Thanks, Phil. Chris Lofts. Chris.
Yeah, thank you, Chair. Lucy, just linking in lateral flow testing to some of the figures you were showing around education, because I'm a trustee of a local school academy that's running 3 schools, and we've been under real pressure with staff absences, which means that for the first time ever, we're potentially looking at supply teachers coming in to assist. And I just wonder, is there a potential to have supply teachers laterally flow tested to make sure they're not spreading infection between schools, because they may well be working in one or more localities?
Thank you, Chris.
Thank you, Councillor Lofts. So what we are pulling together is a strategy that includes testing for teachers in schools using lateral flow devices. It will be for the school to manage that, and therefore if they have supply teachers in, they'll be able to utilise those as and when they're presenting, obviously on a daily basis for teaching. One of the challenges and one of the caveats that we must remember around lateral flow device testing, though, is it only picks up very high rates of viral load. So you have to be quite highly infectious for a positive test result to come back. So when you get a negative test result, it doesn't necessarily mean you don't have COVID. It just means that you are either at the beginning of the virus and not yet infectious, or perhaps past the infectious point of the period of the virus obviously being inside you. So there are some caveats. It's not perfect, and we still are recommending that people get PCR tests as well, but it is going to be one of the things that's able to give a much more rapid view about whether it's safe to be in work on a day-to-day basis. So that's part of the strategy that we'll be rolling out locally.
Thank you very much, Lucy, and thank you for the question, Chris. I think a lot of this is to do with asymptomatic carriers as well, isn't it, Lucy? Would that be correct? In the rapid testing, or is used often to pick up those cases rather than the ones where you've got obvious symptoms, where you would go and get tested per the normal regime. That would be correct, wouldn't it?
Yeah, absolutely. So the real challenge with COVID has been that actually in a younger population, in fact, broadly, the main population, carriage is asymptomatic. So people don't have, the cough or the fever or the loss of sense or smell. So can quite happily go about their everyday life, exposing other people to COVID without obviously ever knowing it. So this is, one of the ways that we're able to test particularly key groups of staff where there's the potential to obviously infect a number of people because of the setting, and to obviously get a result rapidly. As I said, the challenge is it's not as accurate as the PCR testing. So we're making sure that we identify appropriate settings where it either adds a huge amount of value or where you've got a high prevalence. So, you've got a high number of people who may be infected in one particular area, such as an outbreak. And that's where lateral flow will really add that value. But yes, it picks up people who otherwise wouldn't know that they have got COVID.
Thank you very much, Lucy, and thank you for that question, Chris. Do you want to move on to contact tracing update? Because I think, again, this is another one of our weapons against the virus, which has been working very well to date. So over to you, Lucy.
Thank you, Councillor Morris. So we've circulated a couple of slides. I think Cheryl's going to be bringing them up, but the really good news is that our local contact tracing partnership, where we obviously work to complement the national system, is going from strength to strength. So we are obviously still in the process of recruiting additional staff to cover the sort of Christmas and post-Christmas period, because as we've talked about before, we do expect that to be busy, sadly, because we're expecting a spike in cases. One of the things that obviously is worth celebrating is that, you know, nearly every week we see an improvement in the overall performance of the two teams collectively. And again, we maintain a really good position from a point of view of our ability to follow up within the region. So at the moment, we're managing to follow up 87% of all cases, either by our local system or by the national system. If we go on to the next slide. So this just obviously shows the fluctuation, the number of cases that we receive as a local team week by week. And obviously that is in part reflective of improvements in the national test and trace performance, but also clearly reflects the number of cases that obviously are identified in Northamptonshire. So we're still dealing with around 30% of the overall cases. The national team is still dealing with 70% of the cases, obviously being a much larger team, and where we are needing to, if we have any challenges or we have a spike in cases, they still do have additional capacity to take some of that back and support us. They also continue to do the contact tracing for complex cases, for significant outbreaks as well. So that's part of their national arrangements. And on the last slide here, it just shows you again, as we've shown you in previous weeks, obviously a breakdown of how we manage to follow up, or indeed, sadly, still with some cases not, those cases that are identified to us. A lot of them, as I said, are either already contacted by the national system, are part of an outbreak, or are escalated without contact tracing. That means they go back to the national system. And again, they pick those back up for us. Contact traces complete within our own team that are very straightforward, are over 50%. And we still do have, sadly, that around 9–10% of the contacts and cases who just refuse to give any further information. We clearly do obviously follow those up with a letter to make sure that they understand the risk that they're potentially posing to people by not disclosing that information, and by assuring people that we don't want their information for any other reason. It purely is to make sure that anybody who's at risk knows it and knows how and when they should be self-isolating and or seeking testing. So the average number of days from referral to a complete contact trace for those we're able to contact trace is just under 2 days. And that obviously is the national target. So that's good news. Recognise there is always room for improvement, but I'm sure you'll join me in obviously saying thank you to the local team and to my team, who have obviously set this up quite rapidly and have gone, as I said, from weekly strength to strength.
Thank you very much, Lucy. Yes, we would join you in saying thank you to the team there. As I've always said, it's part of our arsenal of weapons against the virus, and to see an 86% success rate, if you like, is very heartening, although obviously we would want to get nearer 100%, but that's, you know, it's certainly an improvement on when the national system was in place. So it's very good testament for the local team and how hard they've worked. So do pass on our thanks to them. Thank you. I'm coming now to Claire Hughes for a comms update. Claire, good morning.
Good morning, Councillor Morris. Yes, so we're continuing in terms of our messaging. The priority is about reminding people that they're still in Tier 2 restrictions right up until Christmas, and the importance of keeping to that. Lucy's already mentioned about the, and I think Toby Sanders has mentioned about the pressure on hospitals. So we still need to do everything we can to remind people to adhere to the restrictions and follow the best guidance. So our key messages are really formulating around that, also reiterating those that call to action for people to get the flu jab for those who are eligible, particularly pregnant women. And then also in terms of the pressure, just trying to remind people if they do need medical attention, then to call NHS 111 to try and ease the pressure on our local hospitals. The exciting news is we've started this week on our Birds of a Feather campaign, so I'm hoping that all the residents around the county will start to see some of our high-profile messaging. We've started a radio campaign on Monday, And yesterday we had some high, bright visual digital panels on vans located and driving around the county at key locations where the shopping centres, entrance to supermarkets, etc. Just trying to get some across those key messages to our target audiences. At the weekend, those vans are sort of being run right the way through up till Sunday. And we will have eye walkers out as well in pedestrian areas and in shopping centres. The same principle, really high visual messaging, so that people can see some of the advice and get reminded, particularly messaging for the over 60s and those households that have members in their household who are over 60, to remind them that they are a vulnerable group and all the things that they can do to protect them. Some of the eye walkers in the vans will be located at the Northampton Saints match at the weekend, because there'll be so obviously quite a few people there. We should get some good footfall and profile. And then alongside all of that, we are doing a number of organic and paid social media activity. We've got a Christmas colouring competition on our Facebook page for young children, encouraging them to colour in Christmas trees, and they get an opportunity to win a prize. Lucy is continuing with her media messaging. So we've got our Lucy's column in the local newspaper, Northampton Chronicle and Echo, which has been sort of covering all the key messages as well. So if you're looking for information on what's up to date, then do read Lucy's column. And of course, we have our regular Friday press conference, which will be again on Friday. And then we're also looking, because obviously that we have a short time now to Christmas, in extending our messaging to outdoor advertising boards, and possibly looking at some mobile messaging with pop-up banners that come into people's mobile phones when they're using apps. So we've got a lot going on, and we are trying to get our messages out across the whole county, whether you're rural or in a town centre. And hopefully you'll see those messages out and about as you're out over the next couple of weeks. Thank you.
Thank you very much, Claire. And as always, thank you to the comms team for what has been a fast-moving river of information. And I think you've done an amazing job to get the messaging out there. It clearly has worked to a degree. So thank you to all of us, to you and your team, who will be no doubt working furiously right up till Christmas and as soon after Christmas as possible. So thank you for that, Claire. I'm looking around for any questions. That don't appear to be any. So it seems like a long way off, but our next meeting of this board is actually on the 7th of January, because we've got Christmas in between, and obviously next week we have a all councillor briefing, which will happen at the same time. So I do urge, same time, but next week, obviously, I do urge all councillors that are on this this call today to attend that and to come along and make sure as many councillors from as many districts, boroughs, etc., come along to that. In the meantime, I guess it's too early to wish you all a happy Christmas, but since we're not technically meeting since until the 7th of January, although I will see many of you between now and then, to those watching that here today, I wish you all a very happy Christmas and a Merry New Year, and see you at this meeting on the 7th of January.